Okay, the three academic streams use three different kinds, not just three different sets of test devices or test approaches, but three different kinds of testing approaches, methodologically speaking. So we are the only team which uses quantitative methods primarily, and educational researcher and human-computer interaction researcher use qualitative methods primarily. I'm speaking about our part, our share in the work, of course. So this rich methodological approach remains to be rich if we go into the smaller details. Even our quantitative methods are threefold. So we try to map the sort of more generalized skill level effects of the system, using the system by psychometric testing, psychometric methods, more specific effects by a new method we called experimental task analysis, and we try to control the adaptive, hopefully adaptive visual design of the mobile surface by eye tracking studies. Okay, very quickly about the psychometric studies. We use the social responsiveness scale of Constantino and Gruber, 65-item questionnaire, very easy and relatively fast to administer, which gives relatively rich data about social skills, communication skills, and partly about general behavioral adaptedness, so to say. It has two versions, a parent and caregiver or teacher version. We administer both versions previously to the testing and right after the end of testing to have a baseline and data about potential effects. A lot of work didn't result here in too much findings. Most importantly, we failed to find any effect on the sample level, either negative or positive, and we were actually very happy about not finding negative effects, because those children in the test group who used the hand system had to give up an earlier support system and switch to a new system, which was not as stable as it could be. Teachers didn't receive as much support as they could have received, so it had a chance that actually the test group produced negative effects, so to say, but we are quite happy about it. They didn't produce any negative effects. Okay, experimental task analysis is adapted from the TEACH method and attempts to combine quantitative measurements with individual focus, in our perception, quite successfully, as the first results show. It focuses very narrowly on specific target behaviors and scales the target skill by the number and depth of the prompts necessary for the kid to execute the actual task. Let me show you just a chart quickly to illustrate this. If you look at the blue squares, these represent the depth of necessary prompts for a particular kid, for a particular task, according to the steps of the task, okay, on the horizontal axis. And the pink triangles represent the same thing after or with using the hand toolset. So you can see that only one prompt was needed for the kid when she used the hands toolset to execute the same task, for which she needed something like 10 prompts before, actually a day before practically. Okay, so on the group level there were no significant positive effects, but if we go to individual data, individual cases, we find a lot of positive and very promising findings. Okay, and eye tracking testing proved to be very useful too. You can see the bad example now on the left side for you. The first design of the daily schedule surface was just awful, and the eye tracking studies showed very, very nicely that kids with ASD are just unable to pass this, this ugly and non-adaptive surface. while we have a positive example too, the helping algorithms worked very, very well, even in eye tracking studies, as we managed to demonstrate it in an interactive task in which the child had to dress up a stick figure on the screen of a computer by the aid of the mobile tool set, and they work very, very nicely in this task. Okay, so just to come to the conclusions very quickly, we see this project as a relatively rare and in some aspects unique attempt to develop and test such an intervention tool set systematically, though there are some very clear shortcomings which were revealed by our testing activity. But altogether with these shortcomings, we see the HANDS Prototype 1 as a in some aspects effective and promising toolkit, especially if we manage to produce significant improvements in Prototype 2 technically primarily, and if we manage to support users, especially teachers, more efficiently than in Prototype 1. Okay, and we see HANDS project as a kind of a model project for further developments. Partly methodologically, we really think that this multi-level and rich methodological approach worked very well in this project in revealing both positive and negative aspects of the project. And also the combination of quantitative and qualitative research proved to be very, very useful. Also we see that many aspects of the system seem transferable to other target populations, and also the system may be a basis to incorporate other aspects of supportive technology. Thank you for listening, and thank you for our partners in cooperating this project.